Welcome back to Clean Hands, Clear Future, the podcast where we dive into the world of infection prevention and control to build a healthier tomorrow. I'm Becca and I'm joined as always by Sarah and David.
Hello everyone, thank you for joining us today in the studio. Definitely not the store cupboard. We are thrilled to be here tackling a topic that's a growing concern in healthcare, and that is multi-drug resistance. It's a bit of a mouthful, but it's really important and it's a massive challenge that's shaping the future of medicine.
Absolutely. I throw myself there. Multi-drug resistant organisms, MDROs, just to make it easier for you. Listeners, bacteria that have evolved to resist many of the antibiotics we rely on, which in turn makes infections harder to treat, last longer, and sometimes even deadly. And today, we will try to break down what multi-drug resistance is, why it's such a big deal, spotlight some of the most concerning resistant organisms, and explore what we can do to manage this crisis.
Okay, so let's get started with the basics. Sarah, what exactly is multi-drug resistance and how did we get here?
Right, so multi-drug resistance happens when bacteria develop the ability to survive antibiotics that would normally kill them. Think of it like bacteria putting on armour. Our usual weapons just don't work as well anymore. This resistance comes from genetic changes in bacteria, often sped up by things like overuse of antibiotics in humans, animals, and even agriculture.
Right, and it's not just one antibiotic failing. These bacteria can resist multiple drugs at once, which is why they're called multi-drug resistant. The World Health Organization has flagged this as a global health crisis because it's making infections like pneumonia, urinary tract infections, or even minor cuts way more dangerous than they ordinarily would be.
Exactly. The CDC estimates that in the US alone, over 2.8 million antibiotic-resistant infections occur each year, leading to more than 35,000 deaths. And globally, the numbers are even starker. WHO projects that by 2050, antimicrobial resistance could cause 10 million deaths annually if we don't act now.
God, that's really chilling. So what's driving this? I mean, antibiotics are lifesavers, but are we using them wrong?
That's exactly it. Overprescription is a huge issue. Think of prescribing antibiotics for viral infections like the flu, which antibiotics can't treat. Patients not finishing their full course of antibiotics also lets bacteria survive and adapt. Then there's the use of antibiotics in livestock, which contributes to resistant bacteria spreading into the environment.
It's almost like we're accidentally training these bacteria to become superbugs. But ultimately, what does this mean for healthcare and infection control?
Well, multi-drug resistance is an absolute nightmare for healthcare systems. First, it makes infections harder and more expensive to treat. And then doctors may need to use stronger, more toxic antibiotics, which can have serious side effects. Sometimes there's no effective antibiotic left, and that's when we see higher mortality rates.
Now, as we know, it can also complicate infection control in hospitals. Hospitals are already high risk for infections. Think about surgical wounds, catheters or ventilators. When you've got MDROs like MRSA or CRE spreading, standard precautions like hand washing and sterilisation, we just need to amp them up big time.
Absolutely. And it's not just hospitals. Nursing homes, clinics, community settings are all seeing resistant infections spread. And this puts a huge strain on resources. Hospitals are then required to look into specialised isolation rooms, more staff training, and more advanced diagnostic tools to identify these resistant strains more quickly.
And let's not forget the economic toll. Treating resistant infections costs billions annually, and patients often need longer hospital stays. Plus, and more importantly, there's the human cost. Families losing loved ones to infections we thought we'd conquered decades ago.
It's definitely a wake-up call. We are, without sounding too dramatic, in a race against these evolving bacteria, and we need to get smarter about how we fight back. But before we talk about any possible solutions, let's zoom in a little on some of the worst offenders. The part that Rebecca's going to love, the resistant organisms that are keeping scientists up at night.
Okay, Sarah, who are the big bad wolves of the bacterial world?
So let's start with MRSA, so methicillin-resistant Staphylococcus aureus. This one's notorious for causing skin infections, bloodstream infections and pneumonia, especially in hospitals. It resists many common antibiotics, and while we've made progress controlling it, it's still a major threat.
Next up is CRE, which is carbapenem-resistant Enterobacteriaceae. You can also get carbapenem-producing Enterobacteria Rebecca thinks she got the hardest one to say. These are gut bacteria like E. coli or Klebsiella that have ultimately become resistant to carbapenems, which are often our last resort antibiotics. Think meropenem and those types of antibiotics. CRE and CPE infections have mortality rates as high than 50% in some cases, which can be scary stuff.
And then we've got Acinetobacter baumannii, often found in intensive care units. It's resistant to almost all antibiotics, and it thrives in hospital environments, infecting wounds or lungs. The WHO has listed it as a top priority for new antibiotic development.
Well done.
And don't forget Clostridioid difficile or C. diff. It's not always multi-drug resistant, but it's a huge problem because it causes severe diarrhoea, often after antibiotic use, wipes out our good gut bacteria. And it's a reminder that antibiotics can sometimes set the stage for other infections.
Exactly. And one more to watch, as if we haven't said enough complicated names already, Pseudomonas aeruginosa, which will probably be pronounced differently by the three of us, depending who you ask. It loves wet environments like ventilators or catheters, and it's naturally tough. Ubiquitous, you find it in the environment, and its resistant strains can cause untreatable infections in vulnerable patients. For example, like those with cystic fibrosis.
These bugs all sound like something out of a sci-fi movie. How do we fight back against these superbugs? Is there hope?
There's definitely hope, Becca, but it's going to take a coordinated global effort. So let's break it down into a few key strategies. First, antibiotic stewardship. This means using antibiotics only when necessary, prescribing the right drug at the right dose, and ensuring patients complete their treatment.
And hospitals and clinics are already rolling out stewardship programs, right? Like guidelines for doctors and tracking antibiotic use.
Exactly. The CDC and WHO have frameworks for this, and they're working. Next, we need to strengthen the infection control. That means rigorous hand hygiene, sterilising equipment, and isolating patients with multi-drug resistant organisms. There's new technology like UV disinfection robots or antimicrobial coatings for surfaces, and that's also helping.
I love the idea of robot cleaners. We need a cool name like R2D2 or something. So what about new treatments? Are we developing any new antibiotics?
We are, but it's slow. Developing new antibiotics is expensive, and bacteria can develop resistance quickly. That's why we're also exploring alternatives like, for goodness sake, another one. Bacteriophages, and these are viruses that attack bacteria, or vaccines to prevent infections in the first place.
These aren't real words, I just...
And we can't ignore the global angle. Resistance doesn't respect borders, so international cooperation is key. Things like the World Health Global Action Plan on Antimicrobial Resistance, they're pushing for better surveillance, research and policies to curb antibiotic misuse in agriculture.
Absolutely, but at the end, let's not forget the role of individuals, especially those on the shop floor, for want of a better word. We can all help by not demanding antibiotics for colds or flu, washing our hands, staying up to date on vaccinations, all to reduce infections overall.
Exactly, so small actions with big impact. It's all about the collective responsibility. So we've covered a lot today. Multi-drug resistance is a daunting challenge, but it's not unbeatable. With smarter antibiotic use, stronger infection control and innovation, we can stay ahead of these superbugs.
Totally agree. And to our thousands and thousands of listeners, you are part of this fight. Next time you're at the doctor, ask if antibiotics are really necessary. Keep those hands clean and spread the word about the importance of infection prevention.
Couldn't have said it better myself, although I could have said some of those organisms better. As always, thank you for tuning in to Clean Hands, Clear Future. And if you enjoyed this episode, why not subscribe?
Yeah, subscribe, and then we can retire.
Absolutely.
And you won't have to listen to these anymore. And leave us a review.
And share with a friend. We'll be back next time to explore another critical topic in infection control.
Until then, stay safe, stay clean, and let's keep building that clear future together.
See you next time.
Yeah, here we go.
Hello and welcome to Clean Hands Clear Future, a new podcast for infection control nurses, and particularly a new venture for ourselves. The three of us work in a small community trust as an infection control team. I will start the introductions with Becca.
Hi, I'm Becca. I don't know what I'm meant to
I can
say.
delete the pauses out.
Good.
Just say like what your clinical background
Okay,
is.
so my clinical background before joining this team was working as a renal nurse in an acute trust and an elderly care nurse, and then working as an immunisation nurse with the community team. Part of my enjoyment of infection control is how varied our role is. It's about going out and speaking to different staff and encouraging their enjoyment and love of all things infection control, particularly around hand hygiene and audit, which is where my passion lies. The thing I find most challenging is working in community trust is geographically how far apart all of our teams are. We can't target them and chat to them as often as we would like in a cohesive manner.
Team lead?
Hello, I'm Sarah. So my background is intensive care in an acute hospital. I actually came into infection control hoping for a bit of an easier life. I thought it would be a sort of 9-to-5 office job, just give me a little bit of a break from the acute. That was 2 weeks before the pandemic happened, so that served me right. But yeah, the thing I love the most is, like Becca said, just the variety you get with it. There's never really a dull moment. I know people think infection control can be a bit stuffy and a bit boring, but actually there's so many different elements to it, and that really do affect our life and our, future generations, our children and so on. Thing I find the most challenging is there's never really like one answer for things. It's always very sort of circumstance based, and it can be difficult trying to sort of relay that information sometimes. And yeah, just like Becca said, with working in a community trust, we cover such a large patch, and it's just being as visible as we'd like to and offering all the support that we can. David.
Hello, I'm David, as has just been mentioned. I have had to correct myself a little while ago because I thought I'd told lies to Sarah when I said I'd worked in infection control for 20 years, but it actually is nearly 20 years. It's 20 years next April. I've seen a lot in those 20 years. There's lots of things that have changed in regards to the infection control landscape. As Sarah rightly mentioned, we had a pandemic that completely upended everything that we thought we knew in regards to infection control and the application of standard principles and vaccinations and mask use, etc. But I've also been fortunate enough to work to my Teesside accent, to work in a variety of environments from an infection control perspective that has broadened my horizons, and I am lucky enough at the minute to work perhaps in the best organisation with the best team that I have worked for.
Aww.
And as both of my colleagues have said, there is a lot of diversity to it and variety, and it's never the same thing twice, and the same infection can raise multiple challenges. And the whole point of this podcast is for us to try to make infection control more accessible and enjoyable for our healthcare colleagues and further afield. Enjoy the first episode.
Yeah, and we would really appreciate any feedback, subscriptions,
5-star reviews.
5-star reviews. Okay, bye.
Bye.